Hey there, welcome to our video on how to stop breakthrough bleeding. If you're experiencing breakthrough bleeding, you're not alone. It's a common issue that can occur when you're on hormonal birth control, like the pill, NuvaRing, Mirena, Nexplanon, and Sprintec. In this video, we'll go over how to stop breakthrough bleeding and discuss specific methods for different types of birth control. So let's dive in. How to stop breakthrough bleeding. If you're experiencing breakthrough bleeding, the first step is to make sure you're taking your birth control as directed, taking your pill at the same time every day, changing your ring or patch on schedule, and getting your IUD or implant replaced on time can all help prevent breakthrough bleeding. It's also important to avoid missed doses and to use a backup method, like condoms, if you miss a pill or are late changing your ring or patch. If you're taking your birth control correctly and still experiencing breakthrough bleeding, here are some methods you can try. How to stop breakthrough bleeding on the pill immediately. If you're on the pill and experiencing breakthrough bleeding, you can try taking 2 pills at once to immediately stop the bleeding. Then, continue taking your pills as usual. If the breakthrough bleeding continues, talk to your healthcare provider. How to stop breakthrough bleeding on NuvaRing. If you're on the NuvaRing and experiencing breakthrough bleeding, you can try leaving the ring in place for an extra week before removing and replacing it. If the breakthrough bleeding continues, talk to your healthcare provider. How to stop breakthrough bleeding on Mirena. If you're on the Mirena IUD and experiencing breakthrough bleeding, you can try taking ibuprofen as directed by your healthcare provider to reduce bleeding. If the breakthrough bleeding continues, talk to your healthcare provider. How to stop breakthrough bleeding on Nexplanon. If you're on Nexplanon and experiencing breakthrough bleeding, you can try taking ibuprofen as directed by your healthcare provider to reduce bleeding. If the breakthrough bleeding continues, talk to your healthcare provider. How to stop breakthrough bleeding on Sprintec. If you're on Sprintec and experiencing breakthrough bleeding, you can try taking 2 pills at once to immediately stop the bleeding. Then, continue taking your pills as usual. If the breakthrough bleeding continues, talk to your healthcare provider. How to stop breakthrough bleeding after antibiotics. Antibiotics can sometimes affect the effectiveness of birth control, which can lead to breakthrough bleeding. If you're experiencing breakthrough bleeding after taking antibiotics, talk to your healthcare provider about using a backup method of birth control and when to resume your regular birth control. How to stop breakthrough bleeding after missing a pill. If you miss a pill and experience breakthrough bleeding, take the missed pill as soon as you remember and continue taking your pills as usual. If you miss more than 1 pill, follow the instructions on your pill pack or talk to your healthcare provider. How to stop breakthrough bleeding after exercise. Strenuous exercise can sometimes cause breakthrough bleeding. If you're experiencing breakthrough bleeding after exercise, try to avoid intense workouts and focus on low-impact exercises like walking or yoga until the bleeding stops. How to stop breakthrough bleeding naturally. Some people find that certain natural remedies can help reduce breakthrough bleeding, such as drinking raspberry leaf tea, taking vitamin C or E supplements, or using a heating pad on the lower abdomen. However, it's important to talk to your healthcare provider before trying any natural remedies. How to stop breakthrough bleeding on HRT. If you're on hormone replacement therapy, HRT, and experiencing breakthrough bleeding, talk to your healthcare provider about adjusting your dosage or changing your medication. They may suggest adding progestin to your regimen, which can help regulate bleeding. How to stop breakthrough bleeding when skipping period. If you're skipping your period on birth control, you may still experience breakthrough bleeding. To stop the bleeding, you can try taking a break from skipping your period and allowing yourself to have a regular period. Alternatively, you can talk to your healthcare provider about adjusting your birth control regimen to minimize breakthrough bleeding. Dealing with breakthrough bleeding can be a real headache, but don't let it get you down. Remember that you're not alone in this struggle, and there are plenty of options available to help you get back on track. By following the tips we've covered in this video and speaking with your healthcare provider, you can put an end to this pesky problem and get back to living your life on your terms. So stay positive, keep calm, and keep pushing forward. Thanks for tuning in, and we'll see you in the next video.